It's really helpful to know what the stages of labor are, not so you can be trying to track everything, but so you mentally know what to be prepared for. And when you start to see your body doing different things, you'll have an idea or indication where you are at in labor or how far along your labor is. So, to start, we'll talk about early labor. So, early labor, you will start to feel contractions. They'll probably be pretty mild to start, and they won't really have a pattern. They'll be pretty sporadic. Usually, the contractions will be anywhere from 30 seconds to maybe a minute long. And again, there generally isn't a pattern. They might be 5 minutes apart, 10 minutes apart, 20 minutes, 30 minutes apart. You'll kind of see it ebb and flow. When you start to have contractions, I will call out the hormone that actually starts this whole process. So, when you go into labor, it's actually your baby that releases a hormone that signals your body to start these contractions. So, once your brain knows, okay, it's time to start the labor process, to start contractions, your body will start to build oxytocin. So, oxytocin is the hormone that makes your uterus contract. This hormone is a lot of times called the love drug, and you can create oxytocin. You have oxytocin flowing through you in many different situations. When you're feeling happy, joyful, a lot of things like kissing, hugging, all of those things will create oxytocin in your body. So at this stage of labor, in early labor, when you know that contractions are starting, but you're not sure, what the pattern is, what is going on exactly, the best thing to do is really to try to relax. I know a lot of people say to ignore it. I don't really like the idea of ignoring your contractions. I think it's more of try to just relax and continue to do things that are going to invite more oxytocin into your body. So, whether that's maybe going for a walk or watching a movie, cuddling with your husband, whatever it is that is going to continue to increase that oxytocin in your body and encourage your body to continue to build those contractions. As your labor progresses, your contractions will start to get more and more intense. And before I go into the second stage of labor, I want to describe what a contraction is so you can understand what the feelings you're feeling, what that intensity is that you're feeling in your body, and what exactly is happening. So, as you're feeling a contraction, what is happening is your uterus, as you would know, your uterus is starting to contract. So, as your uterus is a muscle, so as your uterus starts to contract, your cervix, so you have your cervix at the bottom and your uterus is above it, okay? So, as your uterus contracts, it actually is what is pulling up your cervix. So, you've heard the term cervical effacement. So, this is where your cervix starts to thin out. So I'll put a diagram on the screen so you guys can see what I'm talking about. But every time you have a contraction, your baby's head will continue to push down on your cervix. That's what we want. And it'll start to thin your cervix out. As the baby's head is pressing down onto the cervix, the uterus is contracting and pulling it up. So that is where you get the cervical effacement, the thinning. And the more that it thins out, it'll start to open. And that is your cervical dilation. So as your uterus continues to contract, that muscle contracts, and it is pulling up, it is building the top of the uterus, which is called the fundus. And the fundus is going to be what actually pushes your baby out. So it is building and building. You think about when you're working out, you're your muscle is contracting and contracting. And your muscle, if you ever have noticed, will actually start to get a little bit swollen. It is getting larger and stronger as you're working out. It's the same concept with your uterus. So those contractions have a purpose of pulling up your cervix, thinning your cervix out and creating that opening, but also building the top of your uterus, the fundus, so it can help expel or push your baby out. The next general stage of labor is active labor. And this is where you will start to notice a pattern or more consistency with your contractions. So at this point, your cervix has started to dilate more and has started to efface more. So it is thinning out and it is getting bigger, creating that opening for baby to come down and out. In active labor, this is where you'll notice from a mental perspective that you will start to need to focus a little bit more on your contractions. So in early labor, you'll really be able to carry out conversations and kind of go about things like you normally would. In active labor, you will start to realize that when someone asks you a question, maybe you really have to stop and focus on your contractions to be able to breathe through them and get through it. So that is a good indication that you are in that next stage of labor and that you are getting that much closer to baby coming. And I mention these things as far as just being able to kind of mentally tell where you're at, because these were very helpful for me to know, because I did not personally want to be checked a bunch of times, meaning I did not want my cervix checked a bunch of times when I was in labor. And the main reason I didn't want to was, one, I felt like it was uncomfortable and I just didn't want to be checked nonstop. There are risks of infection. Anytime you're putting something up into that area, you're obviously creating risk for infection. And also, I knew that getting checked and where my cervix was at, as far as how dilated I was, is not really a good indication as far as how far along you are and when baby will come. So yes, it'll show you how far along you are in the sense of, oh, I'm 5 centimeters. But that does not give you an exact timeline of, okay, that means you have at least 4 hours left of labor, or you have 2 hours left of labor. Women can dilate from 2 centimeters to 10 centimeters in 1 hour, or it could take 24 hours. So just keep that in mind as you're considering whether or not you would want to be checked in active labor or early labor, really any point of your labor. Just know how that will affect you mentally. For some women, it is great. They love to know the progress that they're making. But for me personally, I knew that it wasn't going to help me, and I'd rather just take the other indicators or cues my body was telling me so I would know where I was at, or roughly where I was at. In early labor, I mentioned it'll start to become, you'll have to focus a little bit more. And at this stage of labor, it is really great to test out different positions and to move your body around. So remember, your baby is coming down, which means you want to work with gravity. There's a lot of different positions you can be in to help your baby make their way through the birth canal, which is a very, they make a lot of moves to get down and out of you. So try out different positions, different things. I do remember for me specifically, the more intense the sensation was of a position I was in, the more effective I could tell the contraction was, which again, for me, I'm telling you this because it was encouraging to know that that intensity had a purpose along with it. I will also say that this is another reason I personally, and a lot of women, choose to have no epidural, because when you have an epidural, you cannot move around. There are different types of epidurals too, I will say, where you should be able to move a little bit better than others. But generally speaking, if you have an epidural, you will not be able to move freely and get into positions that your body might need to get into to help the baby come out. Your body will intuitively know what to do. You will naturally find yourself getting into positions that feel good, that feel like it's helping you make progress. So I would really encourage you at this stage to move around. And again, sometimes just pep yourself up, hype yourself up a little bit to try something new if you are getting comfortable for a period of time, because that will help things progress. As I mentioned, active labor can vary as far as the length of time that it goes on for, but you will start to see a more consistent pattern with your contractions. As you're nearing the next stage of labor, which is transition, you will find your contractions really getting close together, as close as even 30 seconds apart and lasting for a minute. And when you get to transition, this is the point where you will likely feel like you're exhausted, even if you've only been in labor for 2 hours. It is a point where you feel exhausted, and many women say it's the point where they felt like they just couldn't go on anymore. I'm telling you that because for me personally, it was encouraging to know that when I felt myself getting to that point where I just felt so tired and that I didn't know how much longer I would be able to physically go through it, it wasn't because it was so painful. It was just because I was so exhausted. When I knew I got to that point, I knew I was getting very close to meeting baby. So in transition, this is when your cervix is fully dilated. So you are at 10 centimeters, you're fully dilated. There's some indications again that will tell you that you are at 10 centimeters, and that baby is, very close to be being born. And one of those things are the vocalizations or the noises that you're making. And again, it is different for every woman, but it is very common to start feeling, people describe it as feeling pushy in this stage, where you start to feel a sensation that is uncontrollable that will make you make very deep, for me, it was very deep grunting and groaning type noises. And I felt an uncontrollable urge to push my baby out. I was very excited when I started to vocalize these and make these noises, because I knew baby again was so close to being born. At this point, when you start to feel like you are ready, you're feeling an urge to push the baby out. This is what is called the fetal ejection reflex. So I know I mentioned before that as you're having a contraction, it is pulling up your cervix and building your fundus, the top of your uterus. And that is actually what pushes your baby out. So at that point, that fundus is so strong and it is ready to go, and it starts to actually push and eject your baby out. And that is what you're feeling. Now, every woman experiences this a little bit differently. Not every woman will feel a super strong urge, or, this feeling where it feels like their baby is just coming out of them. Not everyone feels it that way. But a lot of women describe it as you can't control it. Just like if you were vomiting, for example, you can't control the urge you're feeling. It feels very similar to that. Now, you can reach down at this point and you could feel and see if you feel baby's head. That would be a good indication that the baby is very close and that you may be ready to start pushing. Again, Everyone's experience is different, so I won't say exactly when it would be time to push your baby out, but generally speaking, this is what happens during this transition phase, is that the baby will actually start to make its descent down, and you will start to potentially even start crowning, and the baby will be coming out. Now, the truth about pushing is it's different for everyone, but you do not need to be told when to push. I mentioned the fetal ejection reflex, and your body will involuntarily start doing that if you wait and you let that happen. There may be situations where your provider tells you to push. Maybe there's a reason that they're wanting you to try to actively push your baby out quicker, but there really is no reason to have someone tell you when to push. If you have gone through a physiological birth, you're listening to birth cues that your body is making, cues that your baby is giving you, you will know when it is time to start pushing more, or it may just completely be involuntary and the baby will just come out. And I tell you this because not many women realize that our bodies are capable of pushing a baby out. Your uterus is capable of pushing a baby out without any direction or someone telling you what to do. I actually found it fascinating to learn when I was pregnant that there have been women in comas that have given birth. Now, that should really give you confidence that your body knows what to do. And when you start to get to this point of mental exhaustion in transition, just remember your body knows exactly what to do, and you will have your baby in your arms soon. The next thing you know, your baby is born. You have your baby in your arms, but the work is not completely over yet. So at this point, this next stage of labor, really the golden hour, where you'll just want to do skin to skin with your baby and start nursing your baby as quickly as possible. It actually is known to stop bleeding to have your baby nurse because it creates that oxytocin in your body. So the more oxytocin that you have post delivery, the quicker your bleeding will stop. This is why, in many cases, and a midwife will still carry this on hand in case of emergency or for whatever reason they feel it's necessary. But many times, like in a hospital setting, there will be the use of Pitocin. Pitocin is the synthetic form of oxytocin, which will be administered or given to a woman to stop bleeding. So I'm calling that out too, is if you are having a physiological childbirth in a hospital setting, you can absolutely decline routine Pitocin and just request that you have your baby with you skin to skin immediately and not have any sort of disruption for at least the first hour after giving birth. At this point, I mentioned the work is not completely done because you still have to birth the placenta. Now, the placenta doesn't have bones. It is a lot easier to birth than a baby. You will probably within anywhere from, sometimes it could be as quick as 5 minutes, sometimes it goes all the way to an hour. You will start to feel contractions again, and you will just have to do realistically a gentle push, and your placenta will be born. And once that happens, you are officially no longer pregnant. An important part of birthing the placenta is cutting the cord after the baby and the placenta are born. So you're no longer pregnant once the placenta is born, but your baby will still be attached to the placenta. So in a hospital setting, even if you've requested a physiological birth, you've gone through with no medications or interventions, it is pretty typical for there to be immediate cord clamping after you give birth to your baby. This may even be before your placenta is born. And I'm telling you this because it is not the optimal situation to have your baby's cord clamped immediately after birth. And the main reason for that is 1/3 of your baby's blood is still in the placenta after they're born. So it's really helpful for the baby and important for that cord to be left unclamped so the blood can continue to flow into the baby. So they receive all of their blood, all of the stem cells that come with that before you actually clamp and cut the cord. Your provider will be able to tell when the cord is no longer, when blood is no longer going through. You will also notice that it turns white and it will stop pulsing. So that's something that you can request if you, again, are in a hospital setting. Typically, if you're giving birth at like a birth center with a midwife or a home birth, it is more routine for that to be done, to have delayed cord clamping, but it's definitely something that you can request either way. So these are the stages of labor. I'm so excited for you to experience all of these stages and for you to have your baby in your arms soon.